Good.
Folks, I'm Glenn Caldwell with NAL Insurance, and I'm joined today with Andrea Morley. Andrea is the lead nutritionist at Healthy Trucker. Andrea, can you just, for those that don't know, can you maybe explain a little bit about what Healthy Trucker's doing to help our clients stay healthy?
Yeah, so what we do at Healthy Trucker is just try to create different resources and education to help drivers and office staff across the industry to get a little bit more educated on how they can stay healthy in their everyday lives and in their jobs. So we know that drivers face a lot of challenges as far as staying healthy when they're on the road. And we also see that office workers in the industry face a lot of the same issues as far as just having a sedentary lifestyle, not getting out and about throughout their day, and needing to pack healthy food with them for their lunches and their meals while they're working. So we just try to create a space where we can let them know some easy tips and tricks to stay healthy.
Excellent. You know what, I know over the years you've helped, I think, thousands of drivers and staff lose weight through challenges and different events that we've put on. COVID-19 is something that's kind of near and dear to everybody's heart right now. It's something that's top of mind, and you know we're very concerned about what's happening with our immune system. What are some of the things that we can do to help keep our immune system stronger?
Yeah, so when it comes to, we've been hearing a lot of people talking about keeping your immune system strong so that maybe you don't get the virus. But that's not the case, because if you come in contact with somebody who has the virus, the chances that you are going to contract that virus are very, very high because of how contagious this specific virus is. So it's not about not getting the virus. The only way that you're going to be able to not contract the virus or not come in contact with the virus is by staying in complete isolation. And of course, many of us are trying to do that. I know we're working from home and trying to help flatten the curve as far as that goes, and keep others from being at risk and keep ourselves from being at risk. But our drivers and people in the trucking industry, a lot of them don't have the choice to stay home. They've got to keep our supply chain moving. They've got to keep food on our shelves. And we feel for them. We know that that's scary for them to be heading out into the world, and especially across the border, and exposing themselves to the risks of being out there. So what we can do is, knowing that they have a chance of coming into contact with this virus, what they can do is try to strengthen their immune system as much as possible. And what that means is that if they do come into contact with the virus, they're going to have a better chance at recovering from the virus. And maybe they'll have some symptoms, but maybe the symptoms won't hit them quite as hard as it otherwise would. And then they'll be less likely to need medical intervention or medical care. They'll be less likely to need to go to the hospital. And they'll be more likely to be able to just stay home for their 14 days and kind of kick the virus that way and get it out of their system. Now, we all have an immune system, but in different people, their immune system can work a little bit stronger, or their immune system is working at a better rate than for other people, because the immune compromised are people such as older adults. We've been hearing a lot about how we need to protect the elderly because they have a much higher death rate, and they're ending up in the ICUs quite often. But there's actually a lot more people that are immune compromised than just the elderly. So we're looking at people that have pre-existing conditions that we know are becoming really big issues in this COVID-19 virus. So that's things like diabetes, obesity. High blood pressure is one of the big pre-existing conditions that's opening up people to a lot of risk as far as the virus goes. Heart disease, recent bouts of pneumonia, and smokers are having lots of issues trying to fight the virus. And they are the ones that are unfortunately more likely to end up in the hospital and to potentially die from this virus. And that's really scary. So those are the people, and I mean, it's everyone that we're speaking to when it comes to trying to boost your immune system, but especially those people. We want them to be just taking as good of care as possible of themselves right now and over the next month, 2 months, 6 months, however long it takes for us to really rid this virus from our community. And we need them to be doing everything that they can in order to just keep themselves strong and healthy.
I know there was an article you wrote like about a week or so ago that had quite a few of the tips. And maybe if you could share some of those with us as well.
Yeah, definitely. Definitely. So as far as boosting your immune system from just trying to stay healthy in general, a lot of those tips are going to apply to this virus as well. So that's going to be things like getting lots and lots of sleep as much as possible. The more sleep you have, the more that your body is able to rest and recover each night, and then be able to fight off new things that it comes into contact with. So getting lots of sleep, that's on kind of like a surface level. Keeping your nutrition as good as possible. So that means avoiding processed food, junk food,
Right.
as much as you can. I know that a lot of people are taking the time at home right now to maybe eat a little bit more than usual, or eat some junk foods that they were able to pick up at the store. Or they're doing some baking and making lots of treats that way with their extra time. But we want to avoid too much of those foods, because it really does have a negative effect on the immune system, and then your body's less able to fight different viruses and diseases. So we want you to be loading up on lots and lots of nutrient-rich foods, things like plants, vegetables, fruits, as much as you can squeeze those into your day, that they're going to give you more of a fighting chance. And that's for everyone, whether you are a completely healthy individual, whether you're going through a cold or a bout of pneumonia right now, or if you have one of the pre-existing conditions like diabetes or obesity. Now, we don't expect you to try to rid yourself of diabetes right now in order to not be at risk for COVID-19. But it just means that keeping your body a little bit stronger, that or at its strongest for wherever you are in your health journey, that just giving yourself that fighting chance to stay a little bit stronger, a little bit more on top of your game. That's also going to mean you want to load up on hydration. It's going to mean you want to load up on antiviral and antibacterial foods that really help to fight viruses, antiviral foods. So those are things like garlic and onions, turmeric, anti-inflammatory foods to help you out in that way.
What about stuff like oil of oregano? That's something we've been taking quite a bit. Is that something you recommend?
Yeah, definitely. I don't really recommend taking a long-term basis, but during times like this, it can be good to take. Or if you are finding that you are maybe catching a cold and that could potentially be putting you at risk, then definitely or oil of oregano. I mean, that comes straight from a plant, the oregano plant, and any types of herbs are absolutely incredible for helping your body to fight whatever it comes into contact with. So whether that's basil, thyme, and then oregano, they all work fantastic to help your body stay strong, and they help to actually attack those viruses and different bacteria that you do come in contact with.
So big things, plenty of sleep, eat healthy, drink healthy, all the things our mother told us, right? to stay
exactly.
healthy.
And then one kind of misconception, a lot of people like to emphasize exercise as far as boosting the immune system. Now, that one's a little bit tricky, because a strenuous exercise can actually have a negative effect on the immune system, because it is a form of stress. When you're trying to build your strength and get stronger, you're actually stressing the body out so that it can rebuild itself to be stronger, which is, in theory, a great thing most of the time. But at times like this, when we are stressed because we're reading about COVID in the news, and our bodies are stressed because we're possibly coming into contact with this virus, we don't want to be adding more stress to ourselves. So maybe this is a good time for you to scale back a little bit on your strenuous exercise. Maybe you're not running marathons right now, but instead you are focusing on lots of exercise that does help the immune system, things like yoga and stretching, walking. Getting outside and getting some fresh air has some incredible benefits to the immune system. So if you don't live in too populated of an area, if you don't live in say a downtown city or a big apartment building, if you're able to just get outside away from people, of course, and get some fresh air that way, that's going to have a really good effect on your immune system. It's going to stress response, and that will help long term as well.
Well, excellent. Listen, we want to kind of keep this short and sweet and to the point, and I think we've done that. You've provided a lot of valuable information, and You know what? It's been 2 weeks that we've all been quarantined, working from home. It's been different for a lot of us. We're doing more of these communications over the internet through Zoom meetings and that, and I think we're probably going to continue to do these. So, Andrea, thank you again for your insight, and look forward to talking to you again.